What entrepreneurial skills do I need to develop? How can I maintain clinical excellence while building a business? What fears am I holding about entrepreneurship? Where do I need support in this transition? What unique value can I bring to the market? Greetings, everyone, and thank you for joining me on this episode. Welcome to Public Health Entrepreneurs, the podcast for visionary leaders who are ready to transform public health and healthcare through innovation. I'm your host, Dr. Charlotte Huntley, and as a public health entrepreneur with over 25 years of experience in healthcare and public health, I understand the unique challenges and opportunities that fall at this intersection of trying to bridge multiple disciplines. If you are an interdisciplinary professional, a high functioning leader with expertise across different fields, then you know what it's like to see opportunities that others miss, and you understand the gaps in our current systems, as well as having a lot of really good ideas about how to make things better. I know that sometimes having this unique perspective can feel very much isolating and even feel a bit divided across your various disciplines or fields of expertise. I understand. And I want to encourage you, especially on this episode. So, on this episode today, we're going to be talking specifically about really moving from practitioner to entrepreneur. I like to start with focusing on an intention, really being able to set an intention for the week, and then also share some actionable items, action steps for you that you can pick and choose from. And even with the intention that I'll share with you, you may decide to embrace it the way I'm going to share it, or you may want to tweak it and own it, tweak it for yourself. But this is what I have for you. This week, I embrace my entrepreneurial identity alongside my clinical expertise. I recognize that business acumen enhances rather than diminishes my public health impact. I'll let you decide how to go with that. I like it. I like reading that. It makes me feel good. It's very aligned with where we're going with the focus here in the next few steps that I'm going to share with you. So here are some reflection questions. As you note, if you've been following along, especially the last several weeks, I like to share some reflection questions for you. I also recommend that they could be used as journaling prompts. You should document your answers, give each question about a minute or two to reflect, and then write down or type out your response. So there's 5. Here are the questions for you, the reflection questions. You can ask yourself. Number 1, what entrepreneurial skills do I need to develop? Number 2, how can I maintain clinical excellence while building a business? Number 3, what fears am I holding about entrepreneurship? Number 4, where do I need support in this transition? Number 5, what unique value can I bring to the market? Now, here are some specific action steps that you can take to go along with this intention, this focus for the week. All right. So the first action step is business foundation. Establish what your business foundation is. That means draft a mission statement. Mission statements aren't just for nonprofit organizations, if that's what your first thought is to that. I think a mission statement is extremely important for every business entity to have a sense of where the organization is focused and going. So draft a mission statement. Identify target audience. Who is the target audience for who you're looking to work with, your clients, right? Identify the target audience. List core services and set pricing structure. For pricing structure, sometimes I'm going to go on a little bit of a tangent here. People often think of, what is my hourly rate? I think that's a great place to start and to consider, but I also would love for you to consider value-based pricing, where you've got price for your package. Once you may have to start with hourly rates and determine what that will be, and how long it takes you to deliver the solution that you have to your client's problems. But also consider value-based pricing as you move along. And those of you that have already started may have started out with hourly rates, and you may be ready to move on to value-based pricing, which in my opinion can be a little bit more scalable and prevent people from treating you like a commodity. Okay, so I'm going to bring it back to the focus here for the intentions this week and not digress too far on that. So the second action item that aligns with our topic today is skill development. Assess the business knowledge gaps that exist for you and find relevant resources. Maybe join business networks and even schedule learning time. The third action item is market research. So conduct market research, analyze your competition, survey potential clients, and identify market gaps. Also test the value proposition. And the fourth action step that you could take is operations planning. Create service workflows, set up systems, plan resource needs, and develop timelines. This is important. And depending on where you are, if you've already started a bit, this is something that could be a very important thing to be doing right now. Setting an intention along with these action steps will help you create a framework for how you want to experience your week. They help you stay aligned with your values and maintain focus on what matters most to you. If you're ready to work with someone more closely to fully explore what's possible for your vision, then I invite you to consider working with me. As a public health entrepreneur who works with high functioning interdisciplinary leaders, I provide the trusted soundboard and guidance that you might be looking for. Now, this is not something that I often am able to offer, but right now I can. So you won't find details about working with me one-on-one on our website because it's not something that I normally am offering, but you can certainly reach out to me through our website, through the contact me or contact us page or the tab from the menu, and just send a message and say, I heard about this opportunity to work with Dr. Huntley one-on-one on the podcast, and I want to know more. And we will follow up with you and see how we can, what that may look like for you. So our website is publichealthentrepreneurs.com, and we will also have links to that in the show notes page for this episode. All right, everyone. Until next time, have a fantastic rest of your day.